Hello friends, today let's talk about bruxism. Yes, bruxism. What the hell is bruxism? By the end of this video, you are going to know exactly what bruxism is, what causes bruxism, the signs and symptoms of bruxism, what are the complications of bruxism, and the treatment for bruxism. So make sure that you watch this video until the very end. Let's go! My name is Dr. Emmanuel Amukun and I'm a dental surgeon at Marvel's Dental Hospital based in Busia, Uganda. If you are new here, welcome to my channel. Make sure that you don't leave before you subscribe. That is how you are going to motivate me to make another informative video. And if you have already subscribed, thank you for coming back. You're welcome. Take a seat and let's continue. Okay friends, bruxism is just a fancy term that dentists use to confuse you. But it means any movement of your teeth that does not include chewing. Anything else, grinding, clenching, and any other movement that causes the teeth to come into contact and it has nothing to do with chewing your food, that can be categorized under bruxism. And bruxism is divided into two: the awake bruxism and sleep bruxism. And this is actually more common in children. But the one for children does not concern us much because it is self-limiting. It reaches a point and it resolves by itself. So the one we want to focus on today is the one that disturbs adults. So what causes bruxism? Good question. The answer? Nobody knows. Sorry to disappoint you, but that's the truth. Nobody knows the exact cause for bruxism. But as usual, doctors always get some associations. And this is a combination of factors, which include physical, psychological, and genetic factors. And as we said earlier, that bruxism is divided into two: awake bruxism and sleep bruxism. Awake bruxism is thought to be caused by strong emotions. Emotions like anger, anxiety, stress, frustration, and tension. And sometimes it is a coping mechanism or a habit during deep concentration. Sleep bruxism, on the other hand, is however thought to be caused by arousal during sleep. And it is also strongly associated with other sleep disorders. I think you have heard the term sleep apnea. That simply means that when you are sleeping, you have pauses of breathing in which your breathing temporarily stops. And sometimes it is also associated with snoring. But as I said, nobody knows the truth. It is just a thought. We, however, know that there are other factors that increase the risk of developing bruxism. And as mentioned earlier, stress. Maybe you are planning a wedding and budget is not coming through. Fuel prices or school fees or an annoying partner, or maybe your girlfriend has threatened to dump you and you are stressed. Others include age. As I said, it is more common in children, but that's not a concern. The concern is for the adults. The one for the children is not as concerning as the one for adults. Others include medication. Sometimes you may not be able to see what the actual cause is, and it might be medication that is prescribed by your doctor and you are not aware. Other strongly associated risk factors include smoking, beverages with strong amounts of caffeine, alcohol, of course, and other mental and medical conditions like Parkinson's disease, dementia, epilepsy, and others. So what are the signs and symptoms of bruxism? The commonest is tooth grinding. And this can be loud enough to wake up your sleep pattern. And then physically, we may see fractured teeth, chipped off teeth, worn out surfaces of the teeth, exposing the inner layers, which in turn will lead to increased tooth sensitivity. Some people might experience tightness of jaw muscles or even a locked jaw. And some people may experience pain from the ear, and usually the ear is normal. Then dull, regular headaches, and sometimes you can also experience damage to your cheeks as a result of the bites during clenching. If you are following this video, please make sure that you give this video a thumbs up. Come on, give it a thumbs up. So, what complications can occur as a result of bruxism? The most common one is the damage to the teeth, and not only to the teeth, even to the restorations of the teeth, like fillings, like crowns, bridges, veneers, and any other restoration of the teeth. And as mentioned earlier, it can also lead to the damage of the jaw itself or the joints of the jaw. That is in addition to regular headaches, constant headaches, severe facial and jaw pain, disorders of the jaw joints, and ear-like pain. So what should you do if you suspect that you have bruxism? The best thing that you can do is to visit a dentist, because the diagnosis is by physical examination, and we might also ask you some other revealing questions that might actually lead to identification of bruxism, because most people who have bruxism might not even know it, but a dentist is in position to help you to find out whether or not you have bruxism. So if you have bruxism, what is the treatment? Well, if it is mild, then you don't need treatment. But if it is severe, then the treatment will depend on the cause or the likely cause, since we have said the sure cause is still unknown. If it is suspected that the bruxism is caused by sleep disorders, then it will be preferable that we refer you to a sleep medicine specialist, and that one will sort you out. If we suspect that it is anxiety or any other psychological disorders, then definitely we will refer you to a therapist. But what we can do as dentists is to protect the teeth, and we do that by making splints and mouth guards, so that we are able to separate the upper and the lower teeth. Even when you clench and grind and gnash, they don't get to damage each other. If the teeth have already got some damage, then in addition to the splint and the mouth guard, we can embark on restoring the damage. If you have enjoyed this video, please make sure that you give it a thumbs up, and if you have not yet subscribed up to this point, make sure that you subscribe and join the family. And don't forget, there are more videos in this playlist here, and you might also like this video here. Make sure that you check them out, and I'll see you in the next video.